In other news, we're tracking at this hour, 11 Shiv Sena MPs and a Karnataka MLA have written to the Health Minister JP Nadda requesting him to take action against Johnson & Johnson. Action has been demanded to ensure justice for those who suffered because of the faulty ASR hip patients. MPs have also alleged that there are several patients who are yet to approach the committee for compensation. This comes right before a meeting scheduled for the 9th of January, where the committee will meet all stakeholders who are unhappy with the compensation given to them. So this is a rather contentious issue, and attention of the Union Health Minister has been drawn to it. Amitha joining me with more information. Amitha, if you can tell us what exactly has the MPs written in their letter to the Union Health Minister, what is their immediate concern?
Well, the MPs, including, KJ George from Karnataka, have written to Health Minister JP Nadda talking about how several patients are still left in the lurch. Like you pointed out, they've said that a lot of patients have not even approached the committee, which is why, remember, the committee is holding a meeting with all the stakeholders tomorrow on the 9th of January is what we understand. But they've said that a lot of people still are yet to meet the committee. They're not happy with the compensation, and more importantly, they want justice and action against the company Johnson & Johnson. Now, we've written to Johnson & Johnson regarding these allegations by the MPs, and they very clearly said that Johnson & Johnson Private Limited remains committed to providing assistance, including appropriate compensation under the law, to ASR patients in India. But they also go on to say that they've not been given an opportunity to appear before the Central Expert Committee, and critical gaps and factual inaccuracies have been allowed to stand uncontested. That the formula for compensation needs to be within a fully transparent legal framework, and only after proper hearing of the facts and positions of all parties. Hence, there is a meeting with all the stakeholders, including Johnson & Johnson members and patients tomorrow by the Central Health Committee.
Right, but before that meeting happens, Amitha, here is a major push and, of course, pressure being mounted on the Union Health Ministry to take action against Johnson & Johnson. And despite all the justification, the defense that has come from J&J, the matter is pretty serious. After all, it has affected a number of those patients who went through this hip implant. Can you give us an idea of how many people have gone through this procedure and suffered because of it?
Well, according to the numbers, in fact, put out by the company in question itself, there are over 4,700 patients who had these faulty hip implants, is what we understand. However, the patients allege that there could be more number of patients. Even in these number of patients, how many of them have approached the Central Health Committee regarding compensation? Because once the compensation was put out, it was based on age and risk factors, remember, and patients were extremely unhappy with that compensation, saying that internationally the standards given here in India do not meet international standards at all, and they're extremely unhappy with the compensation as well.
Right. Thanks very much, Amitha, for joining us. We'll wait and see what happens in that crucial meeting that you mentioned.